Thanks so much, Brian. October is Breast Cancer Awareness Month, and we're joined by Shirley Chen from the Oncology Drug Access Navigators of Ontario with more about how it can be complicated for lots of cancer patients to access drug coverage. So, Shirley, thanks for joining us. What exactly is ODANO?
Thank you for having me, and I really appreciate this opportunity to be here to bring awareness about our role as Drug Access Navigator. So ODANO is a nonprofit organization, and our members are hospital drug access navigators. We may go by different titles. Some of us are called medication reimbursement specialists, drug access coordinator, or drug access facilitators. We have drug access coordinator, drug access navigator at almost every cancer center in Ontario. So our role is relatively new, so not a lot of people are aware of who we are and what we do. In fact, many patients are unaware that there is a drug access navigator available in the cancer center that are great resources to them during their cancer treatment.
Well, why is it so complicated to access drugs for cancer patients?
Yes, because not all cancer medications are covered by the government or the patient's insurance company, and the cost of medications are very expensive. Typical treatment can cost over $10,000 a month. It's very expensive, and many patients actually struggle to pay for these treatments. And it's a very difficult situation for them where they're faced with a life-threatening illness, and at the same time, they have to worry about how they can financially pay for these medications. To give you an example of a very common scenario is a patient with 80% coverage through their insurance. A typical treatment could cost over $10,000, as I said earlier. That means you'll have to pay over $2,000 a month. That's $24,000 a year. And it's a financial strain for many patients, even if they have a modest income. So that's where the Drug Access Navigator come into play, and we can help our patient apply for provincial funding or additional support through the drug manufacturers.
Yeah, I want to know more about how exactly ODANO helps patients. We have about 2 minutes left. You can take me through some of the ways that ODANO can help.
Yeah, so October is Breast Cancer Awareness Month. So according to World Health Organization, 1 in 5 patients will develop, or people will develop cancer in their lifetimes.
Wow.
Yes, and breast cancer is the most common type of cancer. So there's a lot of advances in, even men are affected by breast cancer too. And patients are struggles to get access to these treatment. Even though the doctor know what is best for the patient, these best treatment may not be covered. Or if they choose to take a particular medication first, it may limit what they can have in the future. That's because there are criteria that needs to be met by the patient in order for funding to be approved. And as Drug Access Navigator, we work with the doctor to figure out what's the best treatment, lines of treatment for a patient. And if there some drug companies have compassionate program where they offer free medications, so we can help the patient take advantage of these programs before they close. And we really wanted to make sure that patients don't miss out on any opportunities and can pay as little out of pocket as possible. So that's where Drug Access Navigator is very important to play a big role in the patient's cancer journey.
And where do they find your program, and what kind of information do they need to provide in order to get help?
Yeah, so the doctors or the nurse, the healthcare team would be able to provide our contact to patients. The key thing is there usually one Drug Access Navigator in every cancer clinic in Ontario. So there's a way that you would be able to get some help from the Drug Access Navigators.
Amazing. So already there, just need to be able to access these resources and get the help that you need from there. Thank you so much for your time today, Shirley. We really appreciate it.
Thank you.
We'll have much more Morning Live coming up just after this.